So, hello viewers. This is our SIH submission for PSID SIH1626, and the problem statement title is Health Data Information and Management System Mobile Application, which was presented by the Government of NCT of Delhi. So, we'll begin with the app at the login page. So, since we need good security on the app, we have different levels of access. The three access levels are super admin, hospital, and patient.
So yes, we will be starting with the perspective of the hospital. So as you can see, there are many functions that a hospital can do. You can see the number of patients this hospital has currently. If you open the dashboard and click on any patient, you are able to see their details and all their medical history throughout their life. The complaints, symptoms, and diagnosis given to them. You can check their medication received. So these are basically the drugs or any therapy they are going through right now. And you can also go back and check their medical examinations like their CT scans, BP, MRI scans, etc. So now when you go back to the home screen, you can even add new patients. So a patient can be added through near field communication or via OTP to ensure that the patient is real and verify their details properly. Now uh, could you switch to the home screen? Yes. So now to edit a patient's info that already exists in the dashboard, you can enter the patient's name and their ID, which is confidential, and a verification code would be sent to them, which can be used. And now we can edit their diagnosis and other details. So like you leukemia, so this app basically will also make tags for different diseases, making it easier for the hospital to maintain and reduce spelling errors and human errors in total. And once the details have been changed, we can save the changes. And now there are also further other features this app provides, like medicine supply. So as noted, many hospitals, especially the government ones, sometimes lack medicines, etc., which is not conveyed properly to the government. So basically other tags can be used to indicate shortage and quantities of these medicines, and also grievances can be filed regarding the same. I will elaborate on the grievance part a bit later. So now please move on to the statistics. So now, as you can see, this app can also collect feedback from various patients who will be given very specific, who can be given very specific surveys for like medicine. So the first one is meloxium. This is a commonly used drug taken by leukemia patients to reduce bone pain. So for example, this is a hypothetical situation that this medicine causes some side effects. So you can see only 3 patients have suffered severe allergies like swelling, while 43% of patients have complained that even after taking this medication there is slight bone pain. So according to this data, the doctors or the hospital can file a grievance against the same, and the super admin can act accordingly. Now we'll move on to the super admin's part, which is an officer from the government who will be using this data to make necessary policy changes.
So going to the super admin page, the super admin is basically a government official who oversees all the statistics and all the details of medicine supply and what schemes that should be implemented based on those statistics. So speaking of statistics, let's just go for overall statistics and see how many registered patients, active hospitals, and patients that are being actively prescribed. Uh, Secondly, you can check the current schemes that are in effect. So these are the current schemes that the government provides, and you can use this screen to find details about specific schemes as well. So, for example, if you're talking about the Janani Shishu Suraksha Karyakram, we can see that this scheme is applicable to pregnant women, sick infants, and to the EWS class. Uh, and you can check the description of this uh, scheme as well. And you can also check how well the scheme is doing overall among the citizens, which is basically the scheme performance. Afterwards, we can see the super admin can see all the statistics of what diseases are there on the basis of district, age, and then overall disease distribution. So, for example, if I want to check the number of cases in Borivali in Mumbai in 2023, I can check this data uh, with this heat graph. And if you want to go in more specifics, you can also check monthly distribution of which diseases are most prevalent at what time. Similarly, you can do this for age as well. You can check the demographic, the severity of diseases that affect the 18 to 45 demographic. And just as before, you can check in more details on a monthly basis as well. And same with the overall disease distribution as well. So these are the graphs that will allow the super admin to judge and suggest schemes more effectively. Then finally, with all the feedback and all the grievances that are filed by hospitals and patients, we can uh, check the medicine supply uh, of medicines throughout every hospital. So as you can see with this graph, you can see that there is a surplus of Atrolip and Pudinara in certain hospitals. Then there's a sufficiency of a certain medicine, and there's also a deficiency of certain medicines. Uh, so this data can help the super admin to judge which medicines or drugs that are not in production as much as they should be, and make decisions with accordance to that. So I'll be passing the torch to the person who is going to explain patients.
Okay, so the patient's perspective will go over the rights. So, as the patient can't be the editing, they will be given viewership rights so they can go through whatever the doctors have added in on about them, and they can also verify that this has happened and this appointment or this medication has been approved to them by the doctor. So, as you can see, the patient's page will go over the vaccines they have taken. So, for example, they it will specify the date at which they were taken and their age, which is segregated to the most recent. And then there would be their major lying conditions and allergies which can be helpful in whenever there is an emergency and the patient can't respond. They can just go through their charts and we'll find their major conditions and allergies that the doctors could keep in mind. Then there would be the doctor's appointments, where this is where whatever the doctors have specified or medicines that are prescribed, the patients can go over through their report on what they are said and the medicines they have received, and they can also report errors on if something is not accurate to what they were told physically. So this can prove as a sort of cross verification, cross checker. It will also show the suggested medicine that the doctors have prescribed, and it would be highlighted on the importance. So the highlighted medicine in red will show the medicine and what it's for and who prescribed it. So the patients will have a list of everything that have been related to their health. So there would be also suggested medicine, and there would be a verification page. So whenever the doctor verifies, uh, takes editing rights, the patient will get a message in the app, and they can verify that, and they can view the prescription that the doctor is newly adding or editing in front of them or in the closest minimum time.
So for this app we'll be using something called Flutter. So Flutter is a framework which uses language Dart. The main advantage of Flutter is that a single code base is used for both Android and iOS, which saves our time as well as investment in creating separate code base for both Android and iOS. So we'll be integrating Flutter with something called Firebase. Firebase is a service which help us to create a data set. So basically the user data will be stored into Firebase, and Firebase have multiple options to create a multiple users. So like patient can view only data, admin has access to most of the data, and doctor can make a specific changes in the app.
Our app hopes to function in a similar manner to Arogya Setu, which was very helpful while during the COVID-19 management process. It will provide general information about all health records of a patient to the patient, as well as different doctors that the patient refers to, allowing for a complete management of health history to be maintained at the same time, allowing for increased access in terms of reachability. Since the Simpson works similarly to Arogya Setu, and since it makes use of mobile networks, which are increasing even in rural and low income areas, all edits and all changes that are made real time would be sped up, and changes could, and real time data could be seen even at the database and government level, which would help them build uh, government decisions, which would help them make government decisions. And the dashboard systems, which would be at a glance, would be able to show areas that need to be focused on. Trends and dashboards that policymakers will look at uh, can be scaled down to even desktop users at on a later stage, and it can help manage medicine supply and demand, which can be a huge issue, especially in certain areas uh, where there is less inflow or influx of uh, mainstream trade. Health status by age and impact of target schemes as well as target goals can be easily tracked, and patient feedback on schemes can help improve the process for the government in making schemes that can help the public. Digital records, since they're shared across doctors, ensure that data is secure and is not lost. At the same time, different privacy features that the app implements ensures that doctors which have not been provided access by the patient to edit or change their records don't have access to these records. Thank you.